This literature review will focus on healthcare disparities for people of color. The question that this literature review will focus on is what healthcare disparities exist for people of color and what needs to be done to combat these disparities. The first article within this literature review is Racial and Ethnic Health Disparities in an Era of Healthcare Reform by Felicia M. Mitchell. This article will discuss the Affordable Care Act and Healthy People 2020, and within that, social determinants of health. Social determinants of health include socioeconomic conditions, food and housing security, quality of education, exposure to crime and violence, and social norms and attitudes. Social determinants of health can either increase an individual's healthcare quality and status, or social determinants of health can lead to disparities. Mitchell reports that these disparities have led to communities of color having a higher incidence of diabetes, end-stage renal disease, tuberculosis, hypertension, asthma, obesity, and HIV, and many more. Mitchell highlights many of the Affordable Care Act's advantages, including health insurance, having a primary care provider, and having a more diverse healthcare professional population. But despite these advantages, the Affordable Care Act does not fully address the larger problem of institutional racism that remains a barrier to healthcare quality, access, and education. The second article within this literature review is Structural Racism and Maternal Health Among Black Women by Jamila K. Taylor. This article discusses the history of obstetric and gynecological health for African American women, as well as discusses healthcare disparities that exist today for women of color. Taylor reports that Black women are 2 to 3 times more likely to die of pregnancy-related causes. Taylor reports that studies have reported that white, English-speaking women and women with private health insurance receive better treatment. Taylor reports that women of color are more likely to be given cesarean sections at a rate of over 40%, while white women were given them at a rate of 29%. This is very alarming because the rates for maternal mortality and morbidity are about 3 times higher for women who had a cesarean section versus a vaginal delivery. Taylor also tells a story of a woman who died of postpartum complications due to a lack of advocacy from the healthcare team as a testament for how many women of color are treated. She says, "The invisibility of Black women that occurs at the hands of healthcare providers and the healthcare system is rooted in bias, discrimination, and racism." The third article within this literature review is Characteristics Associated with Racial and Ethnic Disparities in COVID-19 Outcomes in an Academic Healthcare System by Zhu et al. This article states that Black patients are overrepresented in the number of COVID-19 infections, hospitalizations, and deaths in the U.S. The article discusses many factors that contribute to increased COVID-19 mortality, such as weathering, higher comorbidity burden, inadequate health care, and socioeconomic differences related to unemployment, food insecurity, and housing instability. The article discusses how African American patients had a significantly higher comorbidity score prior to COVID-19 testing than white patients. This article reports the increased disparity of COVID-19 for African Americans and recommends increased investments in testing and prevention efforts in lower socioeconomic status, densely populated, and racially diverse communities. The article makes the point that it is these same communities that are home to a greater proportion of essential workers and thus need increased testing and protection. Recommendations for combating healthcare disparities for people of color are discussed in these articles. Felicia recommends increased cultural competence, the need for a primary care provider, and the need for a diverse healthcare team. The article stresses the development of a cultural competence in healthcare workforce and says cultural competence is developed through conscious, iterative practice to maintain a state of awareness of oneself and personal reactions and intersections with others. Mitchell states that this can be accomplished by reinforcing applications of critical consciousness in healthcare and acknowledging privileged positions that inform health services, education, policy, and research. Mitchell also stresses the need for research that explores the sociocultural measures that reflect such influences as intergenerational poverty, cultural deprivation and disposition, environmental stress, discriminatory social norms and attitudes, geographic location, and proximity. Taylor recommends Medicaid expansion and anti-racist training. Taylor stresses the need for Medicaid expansion to decrease maternal mortality and reports that states that expanded Medicaid saw infant mortality rates drop by 50%, which is much greater than in non-expansion states. She says expanding Medicaid would entail extending the postpartum coverage limit from 60 days to 1 year. There are limitations in these articles, including lack of research that explains methods to decrease negative determinants of health, lack of research and statistics that prove African American women receive lower quality of care due to Taylor focusing on subjective reporting, and a small proportion of the United States population being analyzed in the COVID-19 study. Despite these limitations, these articles did a great job of discussing healthcare disparities that people of color experience and recommendations for how to combat these disparities.